So my name is Erysa, and
And
Jordan
I'm
and I will be presenting on sarcoidosis. So sarcoidosis is also known as Besnier-Boeck-Schauman's disease, and it's an inflammatory and multisystemic condition that causes granulomas to develop on various parts of the body. And granulomas are clusters of white blood cells that will clump together to protect the body against different agents that it finds harmful. And these granulomas are usually benign, so they're non-cancerous. So, because sarcoidosis can affect various parts of the body, the different types of sarcoidosis are specific to the body parts that or organ systems that it affects. So, you have pulmonary, cardiac, cutaneous, neuro, hepatic, ocular, musculoskeletal, and a lot more. And Jordan will get into the types of symptoms that are associated with these body parts later on in the presentation. And in the image on the right, that's an example of ocular sarcoidosis. And as you can see, there's granulomas that have developed on the conjunctiva, which is the white part of the eye. So sarcoidosis is an idiopathic disease, meaning that doctors aren't really sure what causes this disease to develop. And although it's idiopathic, doctors believe that it's due to the immune system reacting to unknown substances. And research shows that those who have a, a close relative that suffers from sarcoidosis are genetically predisposed, and that they may react to infectious agents, chemicals, and dust, which leads to the granulomas to form. So sarcoidosis affects about 180 to 200,000 people every year in the US, and it's more common in women than men. And prevalence is typically higher in people of African, Scandinavian, Irish, Asian, German, and Puerto Rican descent. And the onset is typically between 30 to 50 years old, although this disease can be diagnosed at any age.
Now we'll be talking about normal versus abnormal anatomy. As Arissa said, there are granulomas that form. So this is the presence of multiple well-formed, non-satiating granulomas that you can see on the right, which are compact clusters of epithelial cells and multinucleated giant cells with minimal to no central necrosis. The granulomas are often surrounded by lymphocytes. And you can see right here, associated with sarcoidosis in the lungs is enlarged lymph nodes. All right, so you can go to the next one. So, a couple of signs and symptoms that you can see is shortness of breath, which gets worse with activity, a dry cough that will not go away. You can have chest pain, wheezing, extreme tiredness, fever, inflammation of the eyes, and pain, as Arissa showed you earlier with the granulomas in the eyes, pain in the joints and bones. You can get skin rashes, lumps, color changes, swollen lymph nodes, and weight loss. So, a few diagnostic techniques, and along with they use with your medical history and physical exams, are chest x rays, which is a type of imaging test used to assess the lungs as well as the heart. They do a CT scan, which is an imaging test that uses x rays and computer technology to produce images of the body. They use a pulmonary function test, and these tests help to measure the lungs' ability to move air in and out of the lungs. They do a blood test where they use to check the amount of carbon dioxide and oxygen in the blood to evaluate your liver and kidney function. They do a bronchoscopy, which is a long, thin tube with a light end, and it's used to put down your throat and look into your lungs. This helps doctors view your bronchi, which is the main airways in the lung. They use a bronchoalveolar lavage. This is a procedure in which a sterile saline solution is put into the lungs through a bronchoscope and then suction out. And then they use a lung biopsy, which is a test where they take a small piece of your lungs and examine it under the microscope. Sarcoidosis is usually diagnosed when other lung disorders are ruled out. So, treatment is generally done to control symptoms and improve the function of organs affected by the disease. They use a steroid medicine known as prednisone, which may help with inflammation. They use methotrexate which may be used in severe cases. It's not used often. In many cases, no treatment is needed for pulmonary sarcoidosis. In severe cases, which are not common, oxygen therapy and even lung transplant may be needed.
All right, so now let's talk about some recent findings. In June of 2022, a Yale clinical trial team used JAK inhibitors to treat sarcoidosis. And JAK inhibitors are also known as Janus kinase inhibitors, and they interfere with inflammatory signals and enzymes that are in the body. And the drug that they use is called tofacitinib, and it suppresses interferon gamma in the body, which plays an important role in sarcoidosis development. And within 6 months of treatment, participants started to see improvement in their skin condition. And in addition to improvements in their skin sarcoidosis, those who had additional internal organs that were being affected by this disease saw an improvement in inflammation and disease or an organ disease state in the body. So these are our sources, and that's the end of our presentation.